Before proceeding with parathyroid surgery, you need two things. First, you need the right diagnosis, which we discuss in our video on primary hyperparathyroidism. Second, prior to your operation, you'll need what are called localizing studies. These are imaging tests that can identify abnormal parathyroid glands, which will allow your surgeon to perform a more focused operation, reducing the amount of surgery that you'll need. There are several types of localizing studies, and these include nuclear parathyroid imaging with a compound called sestimibie, neck ultrasonography, and a very specialized type of CAT scan called 4D CT. The sestimibie scan is one of the most important localizing tests. Sestimibie is a radiolabeled compound that has strong affinity for the parathyroid glands, and it's useful for identifying glands that are enlarged or overactive. Sestimibie scans can also be combined with CT scans to further enhance sensitivity. Neck ultrasonography, which we also discuss in the video about thyroid nodules, is fast, easy, and can be extremely helpful. Ultrasound can not only help localize abnormal parathyroid glands, but also provides information about the thyroid gland and surrounding structures in the neck. It's not at all unusual for patients with hyperparathyroidism to have thyroid nodules, and these may also require evaluation and treatment. If you have more questions about neck ultrasonography, watch our thyroid nodule tutorial for a complete discussion. Last, you should know about a specialized form of CAT scan called 4D CT. This test is not often necessary, but it's particularly helpful when parathyroid glands are not in their normal anatomic location, in cases where there's been prior neck or parathyroid surgery, or a sestimibie scan, which we just discussed a minute ago, is unable to localize the culprit parathyroid adenoma. But even when your lab tests prove that an overactive parathyroid gland is present, preoperative localization studies will still sometimes fail. And in that case, doctors will often say that when these studies are negative, the best way to localize an overactive parathyroid gland is to localize a good parathyroid surgeon. Though it may take a little longer, a skilled parathyroid surgeon will be able to explore your neck and find the gland that's overactive, even if it doesn't show up on preoperative imaging. So make sure your diagnosis is correctly made, parathyroid localization studies are completed, and that you work with a skilled parathyroid surgeon. If you do that, your chance of surgical cure will approach 100%. For thyroidparathyroid.com, I'm Dr. Stephen Hodak.